Hey guys, welcome to your rotation at ASNP, the prisoner. So I'm just gonna go really quick on what you should do, how to get here, okay? So just, once you arrive to the prison, just park your car to the right side of the parking lot, lock your car, because if you don't lock your car, they might be able to steal stuff, or they might be able to go over stuff. Once you've done that, you walk to the front office or the front building. It's a gray building to the left side. You walk in there. They only allow 2 people to go in at a time. All you need is your license, okay? Once you go in, you go through the scanner, security scanner. You give them your license, your ID, your license, and they will give you a green card, a visitor pass. Afterwards, you have to go through multiple gates just to go through into the prison. But before that, you need an escort. So you need to call, you need to notify the security guard that you need an escort to go to the OR. All this will take about 10 minutes to do. Okay, so just get here a little early before you go to the OR or for your first case, so that you can actually have time to prepare. To go through all the security and through all the gates. Once you get that, then you're basically up here to the OR with the escort and can set up the OR room and look up your cases for the day. Things that you cannot bring, okay? One of the things you cannot bring is an electronic watch, like an Apple Watch. Another thing that they allow, here's the thing they allow you to bring. They allow you to bring your cell phone, a mechanical watch or a manual watch, pen or pencil, and so basically that's basically it, and your license. They won't get your license. So that's the only thing that you can actually bring. The thing you can't bring is any electronic devices besides your iPhone or besides your iWatch or your Samsung watch or anything like that, or your headphones. So you cannot bring that, okay? Besides that, yes, you can come in. So when you come into an OR, you need to make sure the machine is on and properly functioning. So the first thing you need to do is turn the machine on, which is a little button right here. You just need to press, flip it to on. And afterwards, behind the O2 tank cylinder, there's another Untitled CO2 button that you need to turn on. This is the Untitled analyzer, okay? So you need to turn that on. Third, you need to turn the heater on also. So there's 3 things in the back that you need to turn on. Now in the front, you have your monitors and the machine that hook up to your monitor. You can do the machine check, and the thing that you need to know about your suction. The thing you need to know about your suction is it comes in a canister. This thing is what you need to get. This will always be here already. And there's a specific way to hook up your suction. Okay? You hook up the yellow to the yellow, the suction to the suction, and the patient suction up here to the patient suction. Do not put the patient suction to the yellow. It will clog up the system. I've done that before, and it's a big no-no. Okay, so that's the machine. We will go next to the anesthesia tray. Okay, now we go to the anesthesia tray. Okay, so this is anesthesia cart. This is an anesthesia cart. It is in the supply room in the morning. Okay, it's not in the OR. You need to bring it out here in the OR. And it is not. There's no drugs tray, and there's also no syringe tray. You need to put that up from the nurse or from yourself. So, like I say, this is the drug tray. It does not come in here with it. You need to get this from the from another tray, which I will show it to you. Here's your syringe tray. Okay, this is what you need to get also from another place that the nurse can show you. The thing about syringes, do not throw it in the regular trash can. There's a red box that you need to throw it in. Syringes are a hot commodity in prison. Okay, a very hot commodity with the prisoner. So you do not want to take that with you or throw it in a regular trash. So you need to throw the syringes and all the needles and all the metals and all the glass, the salt container. Every morning you're asking us for your narcotic box, okay? So you have a narcotic box that you need to ask your nurse, and they will give it to you. They will give you, basically the narcotic box has propofol, Versed, fentanyl, morphine, and you can also ask for the ketamine, okay? So that's what you need to ask the nurse every morning when you come here to get your controlled substance. Okay, so now I'm gonna go over the OR rooms. Okay, you have 2 OR rooms that you are mostly control. Okay, the first OR room is over here, and the second OR room is over here. Now, in between those 2 OR rooms is your drug tray. Okay, the one that I talked about earlier. You just get one of this tray. You just get one of this tray and bring it with you to the anesthesia cart. Okay. After you're done with your anesthesia cart, you just put it back here. Next is your syringes tray, your syringe. So here is all your syringes, okay? Now in the bottom, there are trays for your syringe. You just take the tray also and put it in your anesthesia cart. Once you're done, you put it back here. Lastly, this is your supply room over here, okay? This is where you get all your supplies. I will go over in a different video for the supply room. We're now in the supply room, okay? The supply room has everything that you will need for your case, okay? Like for instance, if you need fluids, there's fluids over here. If you need tube sizes, the tube sizes are over here. There's nasal ray, regular endotracheal tubes, and anything that you might need, okay? Also, oral airways and nasal airways down there too. Here's an extra anesthesia cart that you might need for your other OR room. Here is your circuits. Now the circuit sometimes does not come with a mask, so you need to get a mask also, okay? You need to do everything on your own. You do not have an anesthesia tech. You need to supply your own anesthesia supplies. You need to clean your own stuff. You need to wipe things down. Everything is all to you. There's no anesthesia tech. Going further, here's your Miller blade and your Mac blade. Okay, these are disposable. One-time use. Just store it in the red container since this is metal. Okay, so you need to store it in the red container. Do not throw it in a regular trash bag. You need to clean the handle, but the blade is non-reusable. Here's all the other supplies that you might need. Here is your arrow maze or any other thing that you might need. Here is your ultrasound that you might need to do a nerve block or anything that you need, like an A-line or a triple IVs. Here's your glass cups, which need to be connected all the time to the circuit or to the charging, so that so that you have a full battery for your glass cup. Here is also a non-reusable or disposable fiber optic scope. Okay, if you need to do any kind of fiber optic scopes. So that's about it. I also wanted to mention that when you're here, you need to make sure that there is enough supplies for you. So if the supplies are going low, you need to tell the front nurse that there's we don't have enough supplies. For instance, your circuit is low. You need to tell the front nurse we need to order more of those. It will take time for them to order, so you need to tell them ahead of time just to do that. Okay. Okay, guys, we're going to do cleaning and how to clean up your station. Okay. So what you do is you get the wipes. You get the wipes and you clean out everything like you would do in a regular OR, okay? After you're done finishing wiping down everything, you take out your bag, your circuit, and throw it in the trash can. After that, you can put your new circuit in, and your new bag and your mask back up in the circuit, okay? Secondly, your suction, you throw this away. Before you throw this away, you need to use a solidifier. You can get this from the nurse and you put the powder in here, and then you basically close it again, and it will solidify your juice or your content in here and give the waste to the nurse or the surgical tech. After you're done, if you have salts in here or syringes like I have here, you throw it in the safety container in here, the red box, okay? You just throw that away, and after you've done that, you wipe down your anesthesia cart with the wipes, everything thoroughly, so that we clean for the next time, and you put it in the supply room. Now, the thing is, if you use a glass cup, the glass cup needs, or the starlet of the glass cup needs to be clean. That is reusable. But the glass cup itself or the blade itself is non-reusable. You can throw that away in the safe red container. But the stylet, give it to the nurse where they can clean it. Okay. So also the trash, you need to take care of the trash also for yourself too. Okay. So you need to take the trash out, put a new trash bag in, and put the old trash in the back where the nurse will show you where to throw it at. Okay guys, so this is the PACU. Once you're done with your case, you put the patient in the PACU. You are the one who has to monitor them for 30 minutes. After 30 minutes, they can be transferred to the floor, okay? So there's no other way around it, you just gotta wait for 30 minutes, okay? Now I'm gonna talk about how to write your controlled substance and how to reconcile your drugs, your controlled drugs, so that you can put it back to the pharmacy. So in the controlled substance box, the one that you have earlier, there's a piece of paper in here. You just take it out and you just write the patient's name. Basically have the drugs that there's control: fentanyl, morphine, propofol, and Versed. So you starting out, you most likely will have 10 vials of fentanyl. So you just type down how many the one that you use. So I use 1 vials. You write the patient's name here. You write your physician name. You write the dose administered that you administer. And you basically write your name again if you're the one who's administered it, and you go to waste. Once you finish that, you basically need a witness either from the attending or from another doctor, okay, or yourself. So you put your name and your attending's name, and then after that you finish. So you need also to make a copy of the anesthesia record. Okay, so you need to make a copy of the anesthesia record. Once you make a copy, you give it also to the pharmacy too. So you're gonna give the copy, which I made already. You just give it, put it here, and put it inside the box. And now I'm gonna walk you. I do that. You put it in the box. So you carry the box. To the pharmacy, okay? Just ring the doorbell, leave the box here, and then they will take the box and give you a new box later on, okay? So that's all you need to do. That's it. Okay, so once you get the drugs from the pharmacy, they will give you a new box. You take this new box to the nurse, okay? So you walk through the PACU again, because most of the nurses will be in the PACU. But before that, I just want to tell you, this yellow sheet, which comes with the anesthesia record behind the white sheet that you've been writing your anesthesia with, it needs to be put right here so that we can actually bill for it for our own department. After every day or every couple of days, you need to take this yellow sheet back to the main hospital and give it to either Dawn, and she will take care of it for you. So now we're going to go to the PACU, and here's one of our nurses right here. Jamie Lee. Just give this controlled substance to her. If you use ketamine, you need to also make a separate controlled substance drug sheet and give it to the pharmacy so that they can give you a new ketamine. Okay? And she will lock this up in this box right here. Okay? And after that, you're done.